Okay, so today, welcome back. Everyone have a good weekend? No sunstroke? No nothing? Good? All right. No, it's getting hot. It stays hot. So today, basically what we're going to do is we're going to talk about shadowing. And shadowing is really one of those areas that I have been spending a lot of time on recently. The first reason is that although shadowing, if you look at the requirements for for example, any medical school, shadowing is not a requirement. So in other words, theoretically, you could get into medical school without shadowing. However, frankly, it is an expectation. So when you apply to medical school, and for many of the programs in the health professions, they do, one of the questions that they're going to be asking you, or one of the things they're really curious about, is what your insight is into the profession. What do you know about being a doctor? What do you know about being a nurse or a pharmacist? And so a really convincing answer to that is not, quoting last week's episode of Grey's Anatomy. It's probably not a great way to convince people that you have much idea of what it is to be a doctor. But shadowing is, and that's really why shadowing is there. It's kind of proof that you have hung out with a physician, with a healthcare provider of some kind, and you know what they do. So one of the things we want to do today is we're just going to talk about shadowing. And I want you to understand why you're asked to shadow. We're going to take 2 seconds and differentiate shadowing from volunteer work. Then the other thing that I find that's I think of increasing importance is to actually talk about some of the observations that I think you should be making while you're shadowing. That's really interesting, but there are people that sort of think that shadowing is not a great activity and not a good way for students to invest their time because they've never really heard students talk insightfully about shadowing. Shadowing, when we know it's an expectation, for many people becomes one more box to check off. There are really things that I'm going to suggest that you should be looking for if you have a shadowing opportunity, things that you should be looking for that might actually make that experience resonate a little bit more for you. And then if you take time to reflect on those things, it might actually help you when you're talking to people about why you want to go to medical school or another health professional school. For those of you that have tried to find shadowing opportunities, a lot of you, has anyone shadowed? Who in the room? Okay, so we have a few people that have shadowed. One of the big challenges for a lot of students is to figure out how. It's great to know that I'm supposed to shadow, but how do I actually set up an opportunity like that? And it's not, that's the interesting part. When you turn the page in the book, the one page says you got to shadow, and the next page should tell you how to set that opportunity. That page seems to be missing from every book. And that actually has become a huge challenge for a lot of students, is to actually figure out how to secure an opportunity to shadow. So we'll talk a little bit today about some of the opportunities that might be out there for you. Again, you've heard me rant and rave about reflection since we started this. And so when we talk with shadowing, incredibly important to take time to reflect on the experience that you've had. So that you understand the significance of it, you understand the things that you've learned, not only about the profession, but also how you see yourself potentially in the profession. And then the last thing, I think that there are some basic rules, if you're going into a shadowing environment, some rules that are not written anywhere, but are kind of unspoken things that I want you to be aware of. Because it may color how you feel in the environment. It also may color the way people perceive you. So I think it's worth taking 2 seconds to sort of talk about sort of those rules. So why do we shadow? Well, as I said, shadowing is really, that's the way we actually learn what a doctor does. I mean, it's great. We all know, yeah, doctors take care of sick people, yada, yada, yada. We have kind of an idea of what that means, but to actually sit and experience that with someone who's doing it is very different. There are many, many components to being a good healthcare provider. And shadowing gives you a chance to sort of see a lot of those components in action. It is also, I have here that it's the sole way to closely observe a doctor-patient interaction. I'm going to have to modify this slide. It's not actually the only way. It certainly is a great way and a way that's available to almost all of us. there's one other activity that many people now that are trying to get into health profession programs are doing, which also gives you this opportunity, and that's scribing. So there's now a job, medical scribing, and you are actually sitting there in a room as a doctor talks to a patient, and you're taking notes about what that doctor says, and those notes then get sort of transformed into a clinical note that becomes part of the medical record. So that actually, as you're there, you are very much a part of that interaction. Now, the thing about that is you're there for a reason, and you have a job to do. So your main job is not to observe. Your main job is actually record the interaction. But you're definitely in the room when doctor-patient interactions occur. As I said, shadowing really sort of gives you some ideas on like, how do you be a doctor? It's great to sort of say, oh yeah, I'm going to take care of people, but you know, it's great to want to take care of people, but on the other hand, if you have a difficult time sort of talking to a person that you've never met before, if you're sitting there and you feel uncomfortable in those exchanges, you probably actually don't want to be a healthcare provider, because of every day, multiple times every day, you will be required to sit down and have a conversation with someone who potentially is a total stranger. So that's the kind of thing, it's like, what do they do? What are the skills that I need to have? Shadowing gives you a chance to sort of think about those things. Now, one of the things that I want to be clear about, and one of the things that a lot of students get derailed on, is that for some reason people think that you're in the room shadowing to learn medicine. You're not. You go to medical school to learn medicine, all right? You don't shadow to figure out how to treat someone's diabetes. That's not why you're in the room. You're in the room to sort of see how that doctor talks to that patient, how that patient responds to the doctors. What are the easy parts? What are the hard parts? What are the challenges? What can go wrong? That's why you're there, to sort of experience all of that. The learning medicine happens later. All right, so one of the things, I had an experience a couple of years ago. I went to another university here in the state to talk to a group of students much like you that were sort of interested in careers in the health professions, and their faculty advisor had said, oh, you know, shadowing opportunities are very difficult to arrange for our students, so I tell them just to do volunteer work at the emergency room down at the hospital. It's the same thing. It's not the same thing, okay? If you're doing volunteer work, you're there to do a job. You're doing stuff. And it's a great thing to do. I'm all for doing volunteer work, but let's not ever confuse volunteer work with shadowing. Volunteer work, if you will volunteer down in the emergency room, they may have you pushing people around in wheelchairs. You know, it's like, oh, can you take this person over to radiology? Can you take that empty rack there and go down to laundry and fill it up with clean sheets and bring it back to us? Can you file these things, get it? There's lots of things that we do as volunteers. And we are in an environment where healthcare may be delivered, but we are not primarily there to observe those interactions. So volunteer work, you're there to do the volunteer work. All right, so it's really important to sort of keep the two experiences separate. All right, shadowing really is about observing, and when you're shadowing, your job is to be observing those interactions. When you're doing volunteer work, your job is to do whatever you volunteered to do. Okay, so I've had many students shadow me, and I have to say that a lot of times students feel uncomfortable when they sort of walk into a shadowing experience for the first time. And I think that one of the reasons that students feel uncomfortable is they're not exactly sure why they're in the room. And I've had many students kind of apologize. I don't know, should I come with you? I don't want to get in the way. And it's kind of a mentality that I really work with students to overcome. Shadowing, you have a very specific role, and this is an activity. This is not passive. You are not in the room to prop up a wall. In our clinic, at least, the walls are doing a pretty good job of standing up straight without you holding them up. You are there to be observing the interaction between the physician and the patient, or the healthcare provider and the patient. All right, so one of the things that I want to really reinforce with all of you is that there is a lot going on in that room. All right, it's not just one, there are two people, there may be more than two people. There may be a lot of emotion, there may be a language difficulty, there may be a language barrier of sorts that exists. There's a lot of stuff that happens in that room that you need to be taking in. That's the active part. I need you to be observing all of that. It is incredibly important to be engaged. Look at what's going on. Try and sort of understand the dynamic that's happening in that room. One of the most frustrating things for me as a provider, if I have a student with me in the room shadowing me, is to look over and see the student looking at their watch. All right? If you are in a room shadowing and you find yourself looking at your watch, you might as well leave, because you are wasting your time and you are wasting my time. All right? You are there for a really specific reason. You're there to observe what's going on. These are rare opportunities. So don't think that you're there to check off the box. If you're checking off a box, then really it is a waste of your time, because you're never going to be able to talk in any meaningful way about some of the challenges that you might face as a healthcare provider based on your insights into the profession that you've gained from shadowing. All right, so really be engaged. As I said, there's a lot going on, and so I'm going to help you. I'm going to outline some of those things that I'd like you to be looking for, but I want you to sort of recognize what's going on, sort of go through the list of, okay, what exactly is happening here, and then after you've had a chance to, sort of when the interaction is ended and you have a chance to go outside, I really want you to take some time and really think about what you've just seen. Okay, so components to shadowing. Shadowing actually starts before you ever get in the room. All right? Shadowing starts when you walk into the environment where that is going to happen. Now, shadowing can occur in a hospital, it can occur in a clinic setting, it can occur in a private office, it can occur in a clinic out in the community. So as you walk in there, one of the things that I want you to do is be aware of the physical environment. Then clearly, in addition to the physical environment, we have a patient. Yep, that's pretty much has to be. We have somebody that's giving that patient some care or wants to. And then we have a lot of communication going on. And when we talk about communication, I want to be really clear. Communication definitely is a two-way street. It is words coming out of a person's mouth. Those words have to land on somebody's ear and be processed. There's got to be some kind of light of recognition that goes on in the listener's kind of face. And then words may come out, and it's the same thing. So communication really can be a dialogue. So there's verbal stuff that goes on, but clearly you guys all know there's a lot of nonverbal stuff that gets communicated as well. And so the nonverbal things that are happening can sometimes be very, very telling. If you're sitting there and you're observing a conversation and you feel uncomfortable with the nonverbal cues that you're getting from that conversation, assume that there are other people in the room that are feeling as uncomfortable as you are. All right, so we're going to talk again about what some of those might be. So first of all, physical environment. One of the things that we know from a physical environment that we can begin to think about is who's being served in this location, right? Who are actually the people that are receiving healthcare here? And then the other thing, and that has a lot to do, I mean, at University Hospital, we have patients that are flown in, you know, with helicopters landing in all the time. People drive in from far away, people walk in, you know, people are brought in by ambulance. So we service a very, very diverse population. That's University Hospital. If you shadow in other locations, you may see a population that's more homogeneous, it's very specific. Right? So be aware of that. And a lot of times the neighborhood, if you're in a clinic in a community or you're in a private office, a lot of times the neighborhood where that office is located is a reflection of the population that's being served. The other thing that I want you to be aware of is access. All right? And by access, let's talk really easy stuff, all right? What's nearby? If it's a long way to anything, then we have to think, well, how are people actually going to get here? Are they going to drive? If people are going to drive, is there parking? Where is the parking? Is it on street or off street? If you're parking on street, would you want to park your car on the street where patients are expected to park their car? Okay? If you're a person that doesn't have a car, you may have to access your healthcare by public transportation. So, is there a bus stop nearby? It's really great. Bus stop? Oh yeah, it's just a 20-minute walk down the... Okay, so now we can begin to think about potential barriers to accessing healthcare. Right? If someone has to take a 45-minute bus ride and then walk 20 minutes from the nearest bus stop to the clinic, you've already invested, or that individual's already been asked to invest over an hour simply to arrive at the building. Okay, so that's a really, really important thing to sort of take in. The other thing is, you know, there are different kinds of communities, there's different kinds of neighborhoods. Some of them we feel very comfortable walking in, some of them we might feel less comfortable walking in. How do you feel? How are people going to feel if they have to walk through that community? How are they going to feel? Walking, are they going to feel safe? Are they going to feel anxious? Are they going to feel threatened? All right, again, if someone feels uncomfortable walking through the neighborhood to get into that building, you may see that they may be more reluctant to pursue healthcare. It changes the way they think about going to the doctor. All right, and then obviously, let's talk about the most blatant kind of access. Is there a ramp? You know, if you've got people in wheelchairs, how do they get in the building? Is the building wheelchair accessible, or is somebody going to be stuck at the bottom of like 5 steps, looking longingly at the door, trying to figure out how the devil they're going to get inside? All right, so those are the most routine kind of access questions. Inside the building, same thing. What's the physical environment like? What, you know, the facility, is it run down? Is it inviting? You know, in other words, it really does color the way we think about going to the doctors. None of us loves to go to the doctors. All right? For some of us, though, we have to go to the doctor, and if it's something that we have to do, the way we think about it, just, you know, like, is the waiting room nice? You know, I like a chair that's not ripped up, you know, and that looks kind of clean. You know, that's me. But there are things, those kinds of considerations are something that are pretty universal. So when you go into the public area, which is the first area that you're going to enter, and the first area that patients enter, first of all, does a public area exist? The lobby area for the pediatric clinic at University Hospital is a hallway. It's just, and many of the waiting areas at University Hospital clinics are simply hallways that have chairs in them. So there's traffic. You know, it's like, it's really not a really pleasant place to sit, unless you like to people watch, and then you can just watch the people that are wandering by. But if you're not feeling good, and you feel like, it's just to have to look at people and have them look at you, you know, as you're sitting there, it's not necessarily something that makes you comfortable. That's what we have at University Hospital for our waiting areas. And then again, so first of all, does it exist? What does it look like? Is it clean? Is it a mess? I mean, when you walk into somebody's waiting room and there's trash all over the floor, or if there's like goldfish, you know, little kids, you know, it's like that little commercial where the girl's trying to open the bag of potato chips and it explodes and goes up. If there's food all over the floor, you know, if there's drinks that are, you know, somebody spilled a juice box and there's like, it's sticky, it's like, I mean, there are things that can really sort of make you less thrilled to actually be at the doctor's office. And then in general, the ambiance. How does it feel to be in that environment? Does it feel welcoming? Does it feel calming? Do you feel anxious? Is your blood pressure going up as you're sitting there waiting to see the healthcare provider? All right, a lot of that happens all before a person ever walks into an examining room to be seen by a physician or a healthcare provider. Then you have the physical room itself. How big is the exam room? Right? Is it a little crowded place? Are there places for people to sit? Are there enough chairs? You know, usually there's 2 chairs in an exam room. Well, in pediatrics, there's not always 2 people. You know, sometimes we have 4 people or 5 people. Depends on how many kids or grandma may be along for the ride. Or, you know, there's lots of things. So if you have a small exam room and you have more than just the patient in the exam room, is it comfortable? Because you know what? For you to hear what someone has to say, it's really important. Can you imagine how it would be to listen to me yattering on at you if you had to stand while I was doing this? A little bit harder to pay attention. You know, you got a chair, you can slide around a little bit, you know, you've got things to look at. It's a little bit more comfortable, and maybe you can hear some of the things I say. But if a room is uncomfortable, if there are a lot of distractions like that, if there's not enough places to sit, that type of thing, it can impact on the effectiveness of that interaction. Right? So those are the kinds of things. It's really weird, but as I said, we haven't even talked about the doctor or patient yet. We're just talking about all the stuff that's around. All right, now, let's talk about the patient. When we look, so first of all, let's look at the patient. Is this an old patient? Is it a young patient? Is it a man? Is it a woman? So we have gender, we have age, we have socioeconomic status. Socioeconomic status, you know what? We can oftentimes tell that by looking at someone. If someone is, nicely dressed, or at least neatly dressed, if they're able to pull themselves together and sort of, clean up, it speaks to sort of socioeconomic background. If someone is totally disheveled, if they have dirty clothes on, if clothes are not in good repair, remember, they are seeing a healthcare provider. I don't know about your moms, but I always had to have clean underwear on when I went to the doctor. And it's like one of those things, we generally try to pull ourselves together and sort of put on a certain appearance when we go to see our healthcare provider. This person who is sitting in the room has done that. Okay, so this is the best that they could do to pull themselves together to see the healthcare provider. If they're a little bit off, then you have to wonder what's going on that has has impacted on that person's perception of what this interaction is going to be, and their inability to sort of prepare for that. Okay? And that has a lot to do with personal maintenance. And then organizational status. It's the same kind of thing. I'm a pediatrician, so I see a parent or a parent figure. Sometimes it's a grandma, sometimes it's an aunt with one child. Sometimes there are more than, there's more than one child in the room. Well, if you get 2 or 3 kids in the room and you've got, let's say, 5 and under, there's a lot of activity going on there. So it's really interesting to watch mothers, sort of with multiple children, and how they actually herd them. Okay, it's the proverbial herding cats. How good are they at herding cats? How are they organized? Are the kids sitting quietly? Do they have things for the kids to do? Do they have snacks for the kids so if the kids get hungry? Are they able to listen? Remember, if it's chaos, if the kids are jumping all over the place, if there's no one there to distract them, and the mom is constantly turning to speak to a child, every time that mother looks at the child, that mother is not looking at me and not listening to what I say. Okay, so that may be, so that's on the patient side. All right, and then in addition, there's also the patient's emotional status. All right, so if someone is really, really upset, if someone is really withdrawn, if someone is really hyper and just like frantic, all of those things, you don't have to have a conversation. Those are things that you simply can observe. And guess what? There's the same set of variables with the healthcare provider. All right, so it's real interesting, It's like, okay, is this like an old guy that's taking care, an old white guy like me, taking care of a young Hispanic woman, and how is that interaction? And is the old white guy sensitive to the fact that there's someone from a different cultural background that's sitting across from him, and are they respectful of that? Or is this like, total disconnect and like, uh-oh, what's going on there? So there are definitely demographics, and the healthcare providers' demographics also can play a role in that. All of us have good days and bad days. Some days, if you're, there may be providers that don't have a really good filter. And if they're having a bad day, they may just carry that into the room with them, be very short, be very curt, like, what am I doing here? You're annoying me, leave, I want to get done, and that can definitely impact on that particular interaction. How does a doctor present himself? This is pretty much the way I see patients. This is what I wear when I see patients. I'm not a white coat guy. There are definitely people that are white coat people. All right? To me, in pediatrics, white coats tend to be scary for a lot of kids. So, I can be scary enough. So I'm not going to sort of shoot myself in the foot by wearing a white coat. But it's like for some people, it's really important. They like that. It's kind of a badge. It's a demonstration of rank. And so if there's that formality, that builds into sort of the power dynamic in the room. And for some people, that's very important, those kind of outward trappings. And it's the same kind of thing. We talk about sort of the healthcare provider's personal maintenance, organizational status, emotional status, all of those same factors that we talk about in the patient, we also have to think about in the healthcare provider. One of the things that's really interesting, if you shadow and you happen to hang out with the same healthcare provider on more than one occasion, is you'll get an idea of some of the variability that every day is not a good day. And some days you'll go, oh, that guy, he's in a bad mood today. It's like, and you can see it. All right, so it really does give you an idea of sort of how days can vary. All right, so as I said, communication, and that's huge. 90% of my job is talking. All right, and that's and as they said, in the vast majority of cases, a physician can make a diagnosis without ever touching a patient, ordering a blood test, or any kind of radiographic imaging. All right? Most of the time, you can make a pretty good stab at a diagnosis if you take a good history, if you listen to the story that your patient tells you. So there's lots and lots of communication that goes on there. So one of the things we want to be aware of is vocabulary. All right? We go to medical school, we're there for 4 years, we learn a lot of big words. Well, guess what? If you've gone to medical school for 4 years, you know all those big words too. If you haven't gone to medical school for 4 years, there's a good chance you don't know all the big words I know. So why would I want to use big words? Why am I going to do that and risk effective communication? So how is that? Always the test of thumb that I recommend to students is, did you understand what the healthcare provider said? Because you guys, you are all college educated. So you are in the elite in the world, right? But I don't know, maybe 5% of the world actually has a college education, maybe. So education, let's say you're in the top 5% in the world. If you don't understand what the physician has said, how is that patient there who may have an 8th grade education ever going to understand? All right, so that's always, as I said, your basic rule of thumb. If you didn't understand what came out of the doctor's mouth or the provider's mouth, then I will bet money that the person sitting there that needs to understand that has also not understood. The other thing is language fluency, and a lot of times, one of the things if you've taken public speaking, sort of introductory public speaking, one of the rules of public speaking is know your audience. All right, so you speak differently to a group of 6th graders than you would to a group of healthcare providers, those type of things. It's the same idea. There's vastly varied backgrounds that you can see in a doctor's office, and so to try to determine what that background, it really does affect the way you talk to people. All right, so we want to sort of understand that, and also, really critical in New Mexico, you really want to establish what the patient's primary language is. If you have important medical information to convey to someone, you cannot do that in anything except their primary language. All right, and if you don't happen to speak the primary language, it is your responsibility as the provider to find an interpreter. All right, that may be a person that's there that can walk into the room and work with you. It may be that many places have like Skype things or tele things where you can have a little TV set and a little head comes on and helps you. There's also telephone service, which is incredibly annoying because it's a disembodied voice. Right? It's just a voice that you sort of put on a conference call and you say it and then they translate it into whatever language, and then the person there is sitting next to you, hears what comes over the telephone. It's a really, really distressing way to actually conduct an interview. And interestingly, patients hate it for all the same reasons. If you have someone that doesn't speak the same language that you speak, and they've said something to an interpreter, and then they hear how the interpreter changes it, and then what comes back at them, if it's clear that what they're hearing back from the interpreter is not what they tried to convey, then they're stuck because they have no way of telling the doctor who's sitting next to them, no, that's not what I meant, and so you get stuck in these like triangulated conversations is really, really, really frustrating. But understanding the person's primary language is really important. The other thing that I would ask you to sort of look for is look to see if a 10-year-old fifth grader is ever asked to translate for the family. All right? I don't know about you guys, but I'm not sure that I would want to get my medical information from a fifth grader. But that is what we sometimes find providers doing. It's like, oh, you don't speak English? Oh, wait, you go to school, do you speak English? And all of a sudden, this complicated information, somewhat technical, is now being given to a fifth grader to translate for their parents. All right? As I said, I wouldn't want to receive my health information that way, and I think that, if you put yourself in that position, would you like to receive your health information that way? It gives you a pretty accurate way of assessing the effectiveness of the translate. All right, and then of course, all the things that go along with nonverbal communication. So in other words, the position. Where's the physician? Is the physician standing while he's talking to you? While he's talking to the patient? Is the provider standing? Because standing automatically conveys a very, very clear message. I don't have much time. I really don't even have time to sit down. I've got to be out that door. So say what you need to say to me really fast because I'm leaving. Okay? That's standing. If you take the time to sit down, that also conveys something like, all right, we're here to have a chat. Let's begin. The other thing too is that standing, talking to a person that's seated is a power differential. So already we're beginning to sort of say, I'm the big person in this room, you're sitting down, I'm talking down to you. All right, if you sit down, if you're eye to eye with someone, you begin to address the power differential that way and begin to eliminate it. Okay, there's posture, eye contact, even gestures, all right? So just sort of see what it takes to communicate. And as I said, one of the things you want to do is you want to be aware of both the patient and the provider. So as you listen to what the doctor is saying or the provider is saying, I want you to sit there and look, but the next thing I want you to do is look at the patient and sort of say, okay, did a light go on? Is there that? We all know, look in the mirror. We all know how silly we look when we don't understand things. That kind of dumb, like what? That kind of look, like, huh? So I want you to look at the patient, and if they have a huh look on their face, then they haven't understood what the doctor has said. See if you recognize the look, and then if you see it, see if the provider recognizes that look and tries a different tact or a different explanation to get the information across. Okay, so setting up shadowing opportunities can be very difficult. It's frustrating, it can be nerve-wracking. The interesting thing, and one of the things I want you to sort of know, is that healthcare providers really do like to help. They want to help you, all right? But they will almost never answer a cold email. So if you have not met this person before, it is unlikely if you just send them an email out of the blue and say, hey, I think your practice sounds really cool, I want to come and shadow you. The response to those kinds of emails will approach zero, okay? So that is not anything that I would ever recommend. So don't ever cold call a physician and say, hey, can I come and shadow you? It isn't gonna happen. You need some kind of connection to the person that you want to shadow, all right? Now, that can be set, that game of 6 degrees of Kevin Bacon or something. We can do 6 degrees of some physician that you may know, some kind of connection. It can be incredibly, incredibly tenuous, but there needs to be a connection. An example that I have used on occasion, there a couple of years ago, I was contacted by a young man here at UNM he was asking if he could come and shadow me. And it turns out the way he came to me was, there was a nurse that worked in our group who had retired. I'd known her for quite a number of years. She had retired. She still turned up in the office periodically. She came to me and said, Jim, there's this guy there's this guy I need to ask about. Can he come and shadow you? And I said, well, what's the story? Well, it turns out that Kathy had a brother, so Kathy was our nurse. She had a brother in California. Her brother in California was a Boy Scout leader. It turns out that there were 2 Boy Scout leaders in that troop. The other Boy Scout leader was really good friends with one of the Eagle Scouts in that troop. The Eagle Scout in the troop was coming to the University of New Mexico, had told the other Boy Scout leader that he was interested in the medical professions. He said, and I think I need to shadow you today. I don't really know anyone in New Mexico. And the one Boy Scout leader said, well, that guy right over there was originally from New Mexico. So he says, this guy is going to New Mexico. Do you think you could help him? This guy in California calls his sister in New Mexico. It says, you know, there's this kid from our Boy Scout troop that's anyway, yes, he shadowed me, okay? So that's how tenuous the connection can be, all right? But the rest of the story is there was a connection. So I had someone that could speak to that person's character. And that's really what the connection is about. Remember, when you are shadowing a provider, you are an extension of the provider. So if you are a total mess, your total messiness is not going to be a reflection on you. It is going to be a reflection on me. All right? I have allowed your mess to come into my exam room and see patients with me. That's why I don't ever have anyone shadow me that I've never met. Okay? I need some connection, and then when I have that connection, the first thing I always say is, yeah, let's get together and talk about what you want to take away from a shadowing experience. But that's why. Okay? It's like I just need to know a little bit about you before we can set up shadowing experiences. So the one thing I want you to do is understand you need to be imaginative. You need to let people know that you're interested and you're looking for shadowing experiences. And then the other thing, you just kind of have to hang in there and just try and try and try and try. So who are potential contacts? Well, clearly there are professional contacts. So you're in this room, and guess what? Standing in front of you is a healthcare provider who sees patients for a few more weeks. All right, I'm going to stop seeing patients the 1st of October, but for a couple more months, I'm still seeing patients. So I'm standing here, and guess what? I know all of you. All right, so there's a contact. All right, all of us have some kind of family healthcare provider, and guess what? Family healthcare providers, if you've had a pediatrician that you've been going to since you were this big, and all of a sudden you're big and you want to be a doctor like them, oh my God. They want to help you. It's like, come and hang out. You know, they're going to love that. All right, so if you have that kind of a relationship with help, use it. Let them know that you're interested in. They've set such a great example for you that you want to be them when you grow up, and they will love to have you come and shadow them. You go to conferences. You go to classrooms. You know, conferences. A lot of times they say, go introduce yourself to people. Totally. Introduce yourself. Shove your hand in people's hand. Introduce yourself. If you go to a conference, you've heard someone speak that you really like, that you've really been impressed, go up, introduce yourself, compliment them. That was really, really interesting, yada. I'm interested, I'm a biochemistry major, I'm a biology major, I'm a dance major, but I'm really interested in being a PA, a physician, a pharmacist. Is there any way do you ever take students shadowing you? And then they'll go, well, you know, I haven't. And then you say, well, you know, could I email you and ask you about that? And then ask for their card, ask for contact information. But use those opportunities. Some of you are involved in pre-professional groups here on campus, and many of them have speakers. A lot of times those groups are pretty small. So, you know, there may be 6 or 8 people in the room, and a speaker like that, oh my God, go up and introduce yourself. All right? Class presenters, so just in class, sometimes, clearly, you know, we all have teachers, all right? Some of those teachers may know people that are in the healthcare field. They may not be able to give you something, but, you know, just say, hey, you know, I'm trying to get an experience. Do you know anyone that works in healthcare at all? You don't have to know a doctor. You know, if you have a friend, if you have a teacher whose mother happens to be a receptionist in a doctor's office, well, guess what? That doctor knows her. So if she comes in one day and says, you know, my daughter's a teacher at UNM and she has a student that's really, really interested in going to medical school and yada. She says the school is great, blah, blah, blah. She's looking for a shadow. Do you think could I give her your contact information, have her get a hold of you about possibly coming here and hanging out with you? It's like, yes. So that's the thing. So remember that it doesn't have to be a doctor. There's lots and lots of people that have contact. All right, so tell your parents' colleagues, tell your parents' friends, tell your parents' friends' friends. all right? It's just like, yes, and you have friends, and your friends have parents, and your friends have friends, and your friends' parents have colleagues. So in other words, you can sort of say, what we need to do is not be shy about what we aspire to. If you want to work in the healthcare professions, let people know that, and let them help you, okay? And then last are certainly organizational contacts. If you're working, you never know who you're working with. I mean, you know that they're running the cash register next to you, but you don't know, if you don't know anything else about them, it's like their mom, maybe a scrub tech in one of the ORs at the hospital. Find out, you know? Hey, your mom does that? Just, you know, spill your guts. Church. If you go to any kind of a religious organization at all, any kind of a religious community, every religion is about like lifting each other up. We all want to help. So if you go to a religious organization of any kind, tell people there that you're interested in doing this. All right? Let them know they want to help you. People really do want to help you, and if you give them the opportunity, let them know what you need. Very often, they can step up and give you opportunities like that. Many of you are doing volunteer work, so clearly some of the sites where you may be doing volunteer work, there may be potential contacts there. And in honor of my friend Bobby, I have to include the Scouts, because boy, worked for him. All right, so let's talk about reflection. All right, guys, so I've given you lots and lots of things that I want you to observe. All right, there's so much going on, and I really hope that by sort of being very intentional and listing the things that you can be looking at and looking for and observing during one of these interactions, that you find yourself totally engaged during the time that you're shadowing. But the shadowing experience that you have today may be tremendously profound. But if you don't take time to reflect, to write a little bit about it, to sort of try and understand why it affected you the way it did, 2 years from now, this shadowing experience that you had today is simply going to be 2 hours on a long list of hundreds of hours that you've spent doing a variety of things to try and make yourself a more attractive candidate for professional school. If you take the time, and if you do this regularly, to sort of pick a moment, pick something that affected you, and understand how it affected you and why it affected you. Then you can begin to talk about the significance of shadowing. That's really, really important thing. We are shadowing because we need to tell people that we have some insight into the profession. All right, and these kinds of things, these kinds of interactions, these experiences that we're tangentially a part of, can really sort of, if we take the time to dig a little bit, can really teach us a lot about who we are and if we're suited for a career like this. So really, really important, really important. And this I put on there just to remind you, is that seriously, probably the most common reason that people are not accepted into medical school is because they can't talk in a meaningful way about the experiences they've had. All right, they can recount them. Oh yeah, I did 400 hours of shadowing with Dr. McKinnell. He sees a pediatric oncologist, and we worked in the outpatient setting, and it's like, okay, fine, big deal. You know, it's great. You know him pretty well, but what do you know about yourself? What do you know about medicine? Why do you think? What do you bring to medicine that's unique? Why should we take you instead of you? In other words, we're trying to separate ourselves from the pack, and the more insight that you have, the more clearly you can talk about the individual you are, how the world impacts on you, how it changes you, what you've learned, and what you hope to give. That gives you a chance to get into one of the health professions. All right, so when you're doing the reflection, I told you before, I think keep a log. Right? The log should have the date and time, the number of hours, the facility that you're working, the supervisor that you're working under, and sort of, just a brief description of what it's like. But then, in your reflection, be really specific. Pick a moment, all right? And remember, the reflection is not a recounting of what's happening out here. It can start with what happened out here, but ultimately for a reflection to be valuable, you have to be in it. This happened, this is how it affected me. All right? That's the part that's important with the reflection. It affected me this way. Why is that? Why did that affect me that way? Maybe it's because it was a brand new experience. I'd never seen anything like it. I had no idea that something like that could even exist. It doesn't exist in my world. I felt so bad, and I realize now this is the kind, in other words, now we're talking about the kinds of things that we learn about medicine, but also about ourselves, the things that were a part of our lives, the things that were never part of our lives, that are going to become a part of our life if we become a healthcare provider. That makes a reflection valuable. Remember, no one is ever going to ever see this writing except you. But what I want you to have is I want you to have a book of raw material, so that when someone says, write me an essay, write me a paragraph about blah, 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 you know, why you think you would be, you know, the infamous why you want to be a doctor. Okay? That question is a common question, and all of you will be asked that question. The question is not why you want to be a doctor. That's the way the question is stated. What the question, the part of the unstated part of that question is, why is being a doctor the only profession that you see yourself in, and the only profession that you think will give you some measure of personal satisfaction, fulfillment, happiness? That's the question. All right? If we go with question number one, why do you want to be a doctor? Then we fall into the, oh, I want to help people. You and every other person that is applying to any of the health professions has that answer. That's what we get with question number one. With question number two, now it's different. Now we begin to think of this. There are lots and lots of ways, many professions that we can go into where we have the potential of helping people. You don't have to be a doctor to help people. Be a teacher. Seriously, be a teacher. You know, you're going to help, you may help more people being a good teacher than you might ever help being a doctor. Okay, so that's, I mean, there are so many easy examples. Oh, I really like science. Really? Be a science teacher. It's like, great, help other people. You know, there are lots of ways you can help people, all right? But being a physician is a very unique profession. Understand how it's unique. Understand what a doctor does and why you think you'll be happy. What skills do you bring that you're going, you know what? I could sit in that chair, I could do this. I know I can because I've had all these other experiences, and in this experience I had over here, I learned that. We're going to be talking about experiences on Wednesday. All right? But anyway, as I said, this is source material for you. These are your reflections, and these are going to be incredibly valuable when it comes time to write an essay or to have an interview. When someone's talking to you about what you want to do, this is going to give you some really good material to talk to people about. So here's the journal part. One of the things that I want you guys to remember is this last line here. You won't remember. Everyone thinks, I've given up. So if you're old, you know you forget things. If you're young, you think you're going to remember everything forever. And then it takes you like 20 or 30 years to sort of realize, oops, forgot it. And that's exactly what I want you guys to be aware of that. The shadowing experiences you have today, there's so much going on in your life, you're not going to remember the details of it a year from now or 2 years from now. So take notes. And then the other thing, guys, is if you do reflect, as you read through your log, you can also read about your own personal growth. How did your response to things change over time? So if you do that kind of really sort of deep reflection, if you really think about who you are and talk about the individual you are today and how you respond to things that are happy today, if you do that every single time, you'll see your own personal growth. Stories of personal growth are incredibly compelling narratives. If you find yourself in an interview situation, that's what people love. Those are interesting stories. Don't ever undervalue an interesting story. That's what's going to make you an individual, and that's what's going to make you stand out from the other 300 people that are applying for your chair in professional school. So, I told you there were some rules, so these are my rules, I made them up. All right, but why not? Sometimes we get to make up our own rules. So these are the rules that I like when students are coming to me, if you're going to shadow with me, these are the kinds of things that I like you to be thinking about. And they're also, and I think they're pretty generalizable. So first of all, really come in and be committed. You know, this is, when you walk into shadow, know that you're there to shadow and that there is nothing else in the universe that you would rather be doing. If you set up an appointment to shadow, and you have an exam tomorrow, and you're standing in the shadowing room going, oh God, I really should be home studying organic, don't shadow. Call in, say, oh, you know what, I have a test tomorrow, I really need to be studying, I think it'd be better if I studied, and da-da-da. If you cannot focus, if you cannot be engaged in shadowing, do not shadow, all right? If you're gonna do it, be totally committed. Different facilities may require different things of you, all right? The hospital is a big place. Sometimes in certain flu seasons, you have to have a flu shot to shadow at the hospital. You may have to have a PPD if you're gonna, a skin test for tuberculosis if you're gonna do shadowing over a long period of time. University Hospital does a background check. If you're gonna do long-term shadowing, they wanna know that you don't have a police record. So different facilities will have different requirements. So if you're going to shadow someone, ask them where, and ask them if there's any special requirements that you need to take care of before you meet them to shadow. All right? You don't want to be all duded up, all dressed and professionally ready to go. Walk in and sort of say, oh, and have somebody say, oh, did you do this? And you're like going, no, and then have them say, oh, you can't shadow until that's completed. All right, so ask the question, be proactive. Please, please be on time. All right? There is nothing, it's the simple things that make impressions. Remember, these are people that someday you would like to call colleagues. All right, so you want to make sure this is also part of how you're going to be perceived and how serious you are about this pursuit. So make sure you're on time. If you're not sure where you're supposed to be, you either leave 45 minutes earlier so you can get lost, find yourself, and then find where you're supposed to be, or make a dry run the day before, identify exactly the location you need to be so that tomorrow, when you're supposed to be there at 8:15 in the morning, you are there at 8:15 in the morning. Okay, so be on time. Be professional in dress and in behavior. Okay? Professional dress, you don't have to be fancy, no neckties for guys, no t-shirts for guys, no flip-flop for guys, no open-toed shoes for women. Okay? Modestly dressed, it was the most embarrassing thing as shadowing that ever happened to me was one year. One of my students said, oh, can you set up a shadowing experience for me? And I said, yeah. So I talked to one of my friends, a general pediatrician. I said, can this young woman come in and shadow? Yeah. She shows up like dressed to go clubbing. So she's got her smoky eye makeup on, her big dangle earrings. She's got a diaphanous blouse on. You can see her underwear through her clothes. And she is shadowing in a pediatric clinic. And of course, because I was the person that put her there, I'm the person that gets the feedback from the pediatrician going, Jim, could you please in the future make sure that your students understand what it means to come into an environment like this? So if you have any question about whether your attire is suitable to shadow, it is not. All right? Any doubts at all, it's not. Pick something else. It should be fairly conservative for guys. Collared shirts, make sure you're not wrinkly, no jeans, all right? No clothing, regardless of how stylish, no clothing with slashes in it, okay? The 57 razor slashes down the front don't do that, all right? So generally, khakis, collared shirt, women, skirt, slacks, closed-toed shoes, a biggie. If you have excessive piercings, remove them, all right? A couple of earrings, and that's hospital dress code at UNM. You can have 2, I think, piercings in an ear. But if you have tongue piercings, if you have forehead piercings or things like, just take out unusual piercings, don't do that. If you have ink, it should be covered, okay? That's also hospital policy, no tattoos that are visible, right? So if you have them, just cover them up. Okay, and then as I said, you want to be respectful to everyone. So certainly be respectful to the person you're shadowing. You always, the most critical thing, always respectful to their patients, That will get you on the no-fly list faster than anything else. If you are ever rude or disrespectful to a patient, you will never be invited back to shadow in that environment again. And be respectful of coworkers. There is a team that's involved in the care of patients. You need to be respectful of everybody on the team. As I said, I really want you to be retentive. Well, that too, but let's start with being attentive, all right? So I want you to be attentive, I want you to be engaged, and obviously, you gotta just throw it in one more time, just for the 1000th time today. Take some time and do some reflection after you've had that experience to sort of begin to process and understand what it's like, how you feel in that environment, if you think you could work in that environment, if you are going to bring something special to that. Sort of begin to sort of understand who you are and what you're going to bring to the profession. And I think that's it. So, what questions do you have? Yes?
Do you think there's ever a right time to start getting any of these experiences?
No. In fact, the sooner the better. So the thing about this is a lot of times, to me, it's very discouraging when people come to me and they're saying, oh, I'm starting my senior year and I've never shadowed before. Because now all of a sudden, you're going, oh, really? So, because it just changes it. Now all of a sudden you're jamming up your shadowing experience. Like, oh my gosh, I think I need 100 hours of shadowing and I've got to get it done in 3 months. And so, and that gets, that's conveyed. So in other words, when you're talking, when you're writing down the experiences you've had, that is going to be part of like the experience, the time frame. And this month I shadowed 100 hours. That's a lot of shadowing for 1 month. Where if you space that out over time, first of all, it's not such a burden. When people ask me how many hours of shadowing should I have, I'm sitting there going, well, I made up them, because I make up stuff. You got that. I made up the rules. I made up a number of hours that seemed reasonable. If you shadow a half day, 4 hours, 1 day a month, okay? That's 48 hours in a year, right? 48 hours in 1 year if you do a half day a month. And if you have 3 years between the time you're sort of getting ready and the time you apply, it's 150 hours of shadowing.
Because I had somebody, I was asking around to get like a research experience,
Uh-huh.
and they were like, I wouldn't want a student like you in my life because you haven't taken these classes yet.
Research is very different. Okay, so you have to remember those are technical. There may be knowledge involved. All right, so if you're looking for a job in a lab, they may want you to have some basic science experience, and they may want you to have some fundamental, knowledge that's going to allow you to function efficiently in that environment. Shadowing is really different. Remember, it is not a negative outcome. If you have a shadowing experience and decide, oh my God, this is horrible. This is not what doctoring is supposed to be. I do not want to do this. If you have that experience, second semester of your senior year, after you have committed a lot of time and effort being a pre-med student, getting all those courses done, and going, I don't want to do that. That's not a happy revelation. All right? Now, if you start second semester of your freshman year, going, oh yeah, I want to be a doctor, they look really cool, and blah, 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 and then you go and you shadow somebody and you're like, oh, that's not what I thought it was going to be. It's like, okay, good. Now you've got 3+ years left in your education, and pre-med or pre-whatever doesn't have to be a part of it. And you can really sort of say, okay, that's out. What do I want to do? So coming to the conclusion that you don't want to be a healthcare provider, to me, is one of the most valuable things that you can learn in shadowing. The same way that understanding or having it reinforced that it's something you do want to do, it works both ways. And as I said, the earlier the better. So shadowing, different than research, but shadowing you can't start. I wish we could, the university does not allow us to take high school students any longer. I seriously wish we could take high school students. But there's some technical reasons that we can't. So the earliest you can start shadowing, the better. Because then it just gives you an idea, yep, this is what I want to do. And then the more that you do it, you're going to learn, your perceptions of the field are going to change. The more you learn, it can reinforce, yes, this is the right decision, this is totally what I want to do. Or you may go, wait, this was good, but one good day, now I've had 7 bad days in a row, and maybe this isn't all that it's bucked up to be. In which case, again, we change our minds. Okay? Other questions?
What
Yes.
are some reasons that people never get into medical school? Like even if they apply once and they don't get in, and they do the exit interview and they follow the steps that were given to them in the exit interview, what are some reasons?
So it's a hard question and a fair question. So I think that you can kind of break it down into a number of things. I think that first of all is academics. I think that there are certain things that you simply have to have a certain academic record. You've got to be able to do the work. And as challenging as being a pre-anything student may be, when we're in it, we think this is the hard part. This is not the hard part, guys. The hard part starts when you're accepted into medical school. That's when the hard part starts. But the academics, as challenging, as rigorous as you've created a schedule for yourself now, cannot in any way touch the volume of information you will be expected to process when you're in medical school. So that really challenging part of academically starts in medical school. It doesn't start before. So academics, you've got to be able to show people that you can handle the academic part of it. Okay, so that's that part of it. Half of an application is academics. So 50% of that consideration is going to be academics. And the other half is everything else. It's like, what do you understand? Do you understand what it is to be a physician? Do you understand what it is to be a doctor? Why do you want to do this? What do you bring? What is unique about you that you're going to bring into this? How committed are you to the process? Those are all kinds of things. What have you done to show that you really are committed to really pursuing this? And that's why the application's challenging. We do ask you to try and do a lot of stuff, and I've tried to sort of make it clear to you why different things are asked. Can you do all of them? No. Should you try to do all of them? No. Really, if you try to do everything, what you're going to fall into is that checking off boxes thing. And as soon as anyone detects that you're a box checker, then you're out. Because then it's just like, then it's expediency. Oh yeah, she did 25 hours of volunteer work because that was a box that had to be checked. She had to do volunteer work. Okay? So, and then the rest of it, the communication part is really, really critical. In other words, that ability to talk about the experiences you've had, how they've impacted on you, what you've learned about not only the world around you, but what you've learned about yourself and your place in the world and how you hope to impact on the world. Your ability to convey that is really, really critical. But that's just communication skills. And as I said, so much of what this job is talking, is communicating with people. And if you can't do that, if you cannot present yourself well verbally, either written or speaking, you're not going to get in. So that's why those essays, the chances that you have to write, incredibly important. And really, the personal statement, that essay, that 5,300 character piece of writing that you get to do to tell somebody that's never met you before a little bit about yourself, probably the most difficult essay you will be ever asked to write, and probably the most challenging. Okay? So it's not one of those things you want to sit down when your application is due by midnight on Sunday. You don't want to sit down on Saturday afternoon and write your personal statement. Okay, you really want to sort of take some time and really, really work on that. But so those are the two things. So either academically, people feel like the academic record isn't strong enough and there's concerns that they won't be able to handle the academic load, or communications-wise, if people aren't effective communicators, then I think those are I think the two kind of big areas that you can think of on the two halves. Other questions? Yes?
Is there any minimum or the preferred qualification to ask, if I can shadow? Like,
is there any
minimum qualification?
No. At UNM, to shadow at UNM, there is a process that you have to go through. So that for UNM shadowing, you have to go to the volunteer office. And basically, they start everyone with what's called a short-term shadowing packet. So there is a packet that you have to complete. It's got a module about HIPAA, which is the Federal Patient Privacy Guidelines. It's got another module about compliance or something like that. And then you have to have a piece of paper signed by the physician that you're going to be shadowing. And I think they ask for a couple letters of recommendation. I don't know if they ever actually call the people that you put down. I truly don't know that. I think lots of people have used me as a reference, and I don't think I've ever been contacted from the volunteer office. But yeah, so there's minimal stuff here to shadow. Other than that, and then As I said, the challenging part for most people is, again, finding the physician that will take them on as a shadowing student. I'm hopeful that in the course of the coming year that I'll be able to, I'm trying to accrue names of providers now that would be interested in having pre-med or pre-professional students shadow them. And so hopefully my office over here will become a resource. So it'll help you guys sort of identify people that you can shadow. Remember, guys, and I'm just going to toss out one other thing. The kind of doctor you shadow is totally irrelevant. Okay, so you're like going, oh, I want to be a neurosurgeon. You do not have to be a neurosurgeon. Before you're going to be a neurosurgeon, you're going to be a doctor. Okay, so you don't get to skip over all the doctor education part and jump right into the neurosurgeon education part. So you got to be a doctor first. It's a long haul. So you want to make sure, yes, I want to be a physician. You get those insights shadowing anyone that's providing healthcare. Okay, so as much as you sort of say, it's really good to sort of know why you're interested, in other words, what sparks your interest, but not critical that you shadow someone in that. Really the question before I want to be a cardiologist is, do you want to be a cardiologist? That's not the question. The question is, do you want to be a doctor? That's the first question you have to answer, and that's what we're going to answer by shadowing. Okay? Yes?
Oh, so I guess you just said this, but so if we have your contact information, if you're interested in shadowing throughout the year, we can just contact you and you would be able to help us with
Yep. You lucky ducks. Other questions? Okay, guys, so on Wednesday, thanks for hanging in there with me. And on Wednesday, what we're going to do is we're going to talk about experience. We're going to talk specifically about experiences. And basically the kinds of things, the reasons that we ask for all those different kinds of experiences, and the kinds of things that you may not necessarily think about that you already are, that are a part of you that you've gained from some of the experiences you've had, whether they're work experiences or volunteer experiences, but some maybe critical skills that you have that you may not be aware of. So I want to sort of, again, be very intentional. I want you to be able to talk about your experiences, and I want you to understand how important even mundane experiences like sort of, I don't know, running the cash register at Chick-fil-A in the sub, or, working at our Dion's, fast food, there are things that are part of that are potentially a part of that work experience that you've had that may be very, very relevant to the practice of medicine. So we're going to talk about that kind of thing, just again, to sort of help you sort of think about things a little bit differently. So we'll do that on Wednesday.